Okay. Hello, everyone. I'm Dr. Cindy Knapp, if you haven't met me before. And I have to tell you, I understand I'm talking to many, but I am staring at a computer and this is very weird for me. So bear with me. Before we start the talk, I'm told I have to acknowledge a couple things. So our sponsors for today are Zomedica and PulseVet. We want to thank them for helping us put all of this together. Also, if any of you guys have any technical difficulties, please send a message to Izzy on the chat box, and she can go ahead and help you with that. If you have any questions or questions that you want to ask during the talk, use the Q&A box or that little tab, and then we will answer those questions at the end. And then also, did I do something wrong? Okay. And then also, one of the things I'm gonna show you is this geriatric fitness guide. And if it is one that you guys would be interested in getting and maybe creating one for your own clients, you can email Izzy and she can send you the PDF for that. So, again, today we're going to talk about our senior pets. And I have to tell you, this really is a subject that I've grown to be very fond of. If you don't know, I've been working here at SAMP for about 6 years, and I used to do ER, and I used medicine for over 20 years. And my biggest thing was seeing these older animals that they were fairly healthy, but just having a hard time, getting up and walking. And so I just felt that there had to be more that we could do. So as you guys all know, it's a growing field. And I think it would be really beneficial if we taught our owners and we learn more to teach them how to help their senior pets age and more gracefully as they go through their lives. So let's get this started. So in this talk, hopefully we will cover these 4 main points. Can we slow down the aging process, which I truly believe we can. Helping owners determine what pain our seniors are actually showing them, and understanding that managing pain in our senior animals is really a multimodal approach in helping them get through their years. And then what can we do and what can we encourage owners to do to kind of optimize their quality of life? Oh, what happened? Is he? Right. Okay, there we go. So again, what is aging? That big question is aging a disease? And it really is not really a disease. It's that process of, yes, becoming old and older, but it's that changes as we get older that can cause physiological and pathological changes. Aging is a modifiable risk factor. And what that means is we can make some changes and improve their quality of life by just making, certain changes. So we can't quite stop the aging process, but we can definitely slow it down. Sorry to see this. Thank you. Every time I point it, it's there. Okay, so in 2019, AHA had these life stages guidelines, and the senior animal is considered to be the last 25% of their life expectancy span. And as you can see on the screen, the estimated lifespan for smaller dogs are a lot longer than, say, the larger dogs. But it's not to say we can't get the larger dogs into, say, 10 years or so. And then a geriatric dog is considered to be an animal, or even a dog or a cat that is at their life expectancy and going beyond that. So what can we see in our seniors? Believe it or not, the majority of a lot of our seniors are actually obese, and that's kind of surprising because they are also losing muscle. And as you can see in number 3, they're developing what we call sarcopenia, and that's basically muscle loss, which is natural aging as well as due to immobility. But what's hard is they're losing muscle, but they may still have a lot of, unfortunately, fatty tissue. We can see animals that have osteoarthritis, which will mimic, and they'll show lameness. They can show stiffness. We will definitely see cognitive decline, and some animals will go to the point of developing CDS, so that cognitive dysfunction syndrome. They can start having changes in their sleep cycles, sleeping more during the day. We can see, incontinence, and we can start to see some hearing and vision loss. And the natural one is, you'll start to see graying of the muzzle or the fur in general. So can we slow it? I truly believe we can. And I think one of the main components is stressing to our owners to maintain a healthy weight throughout their lifespan. So as most of you may know, Purina did a lifespan study. And what they did was they followed, these Labrador retrievers throughout their entire life, through puppyhood all the way to adult. And what they did was there was a group of them that they actually fed 25% less calories than the other group, the control group, excuse me. And what they found were these animals that were fed less and maintain a lean body weight actually lived about 2 years longer than the ones that were just fed, more. And so it was the first study that did show that diet restriction really did increase the survival time in these large mammals, specifically the dogs. And so ideally, as for a senior, we would like to see them at a body condition, as you can see at the top, where you can kind of see the outlines of the ribs, not completely. You can see a waist from above, and that abdomen is tucked. So if you scaled it on a body score conditioning, ideally, a 4.5 to 5 out of 9 would be lovely. They also did show on this study was that the control group, that they didn't control the feeding, they started showing visible signs of like graying of the muzzle, the impaired gait, and decreased activity. So it's really important to help educate our owners about weight management, because what research is showing that obesity is really the #1 factor in the development of OA. And OA, as you can see, is one of the leading causes of why owners will seriously consider euthanasia, because the animals are in pain, they don't want to walk or get up and move, and just pain itself can be really detrimental to our older animals. And what they are finding, especially in human medicine, is that this fatty tissue, or this adipose tissue, is pro-inflammatory. And that being said, you know, another major component would be proactively managing inflammation. Now, acute inflammation is good because it tells our body that there's something going on, but it's that chronic inflammation that can be pretty detrimental to the body. So it's that it can be that silent killer. And it's just like, you know, in humans, that chronic inflammation can just do a lot to our body. And remember, anything with itis, so osteoarthritis, is inflammation. And in human medicine, they are showing, they're actually doing research on that. If you notice, inflammaging, it's that low-grade chronic inflammation that doesn't necessarily have an infection or anything, but it's occurs during that aging. And it has been shown to, you know, be associated with increased morbidity and mortality in the aging population. And as all of you know, it's a nidus for so many diseases in our animals, with such as IBD, diabetes, heart disease. We can see it in cognitive dysfunction syndrome and OA, to name a few. Other ways we can help slow the aging process is definitely preventative care. You know, being on top of, hopefully they're coming into us, and you know, we can check on them and see how everything's going. Exercise, very critical, can definitely help. Got to keep them moving, can help decrease some inflammation, as well as nutrition. There is a fantastic book out there called The Forever Dog. If you haven't already read it, looks like that. But it's a great book. It's all research based. And the gist of the whole book is, in order to help our dogs live longer lives, it's diet, nutrition, and exercise, just like us humans. So what kind of pain does our senior animals show? Okay. The hard thing is that many of our seniors and geriatrics suffer from chronic pain. Okay. And it is caused by chronic inflammation. And it may be that it initiated from some type of tissue damage. But what happens is the tissue may have healed, but the pain just never went away. There's also potential nerve injury. I do believe that a lot of the pain in our seniors are undiagnosed. You know, owners, I'm sure you guys have all heard it. Owners are saying, yeah, they're just getting old. But they're not. I mean, they're getting old, but they are showing subtle signs of pain. And one of the areas I do think our animals do suffer a lot from is myofascial pain. Okay. The other thing that we notice is they're just really good at hiding their pain. So like I said, the changes are very slow, they're subtle, and you know, they just may be showing things at home, and then they go for a walk and they're really excited about a walk and they don't really show it. And again, many owners, they just don't recognize it. So I mentioned myofascial pain. In humans, what they do find is there's a lot of myofascial pain syndrome. And what that is, it's a deep aching and pain in the muscle. It's pain that doesn't necessarily go away, and it can get worse. In some cases, there can actually be a tender spot, a knot, such as a trigger point. Many of these animals may have trouble sleeping due to pain, and they're just not feeling well. And you'll see a lot of these animals, they're just tired, okay? And a lot of times it can be affected more. It can start by, they just are immobile, or their pain develops because they're compensating for an injury that they had, and we're not paying attention to the compensatory changes that they've developed. For instance, like if they're favoring one front leg, and so they're now compensating along their back or the other shoulder region, and it just gets tighter and tighter. So that's where we can start to see myofascial pain. And keep in mind that the fascia it covers everything in the body. And that's why it's so important. That's why, one, it's really important in acupuncture. It's important that when you don't stretch out those muscles, everything gets tight and everything can get sticky. So I believe myofascial pain is a very important thing for us to think about with our animals getting older. And what happens is if we don't address pain early on, they can slowly develop what we call maladaptive pain. And I'm sure all of you guys have heard all of this, where, it's that pain that, again, maladaptive pain is it's non-productive in the body. The body just doesn't do anything with it, yet it can become a major problem in our older animals. And we really don't want to get to the point where it can develop into what we call allodynia, where all you're doing is petting your dog and they're like become, they may snap at you, or they may snap at another dog, or so, and that's when the pain has gotten so bad. So what do we see? Initially, sometimes we can only see lameness. Owners may only see a lameness, but many times they'll wait until, maybe the animal will walk it out. There are times when, we can see possible aggression. I think that's when we're really at a point of maladaptive pain. We can see changes in appetite. We can see isolation seeking. If an animal, you guys all know, if there's a change in behavior, if an animal is really friendly and then all of a sudden they're not friendly anymore, or they're, hiding more, or if they're ones that are kind of, especially cats, if they're like on their own, but now they're like in your face all the time, that kitty may be telling you there's something wrong. Here at Sound, a lot of times, we'll ask them, what with their transitions, are they having problems getting up and down? From a down and a sit, are they hesitant to actually sit down? Because if they're hesitant to sit down, a lot of times it may be they have lower back pain. Stairs are a great way. If they have stairs, is the animal hesitant to go up the stairs, then it's usually hind end related. If it's hesitancy to go down, it's usually that front end. Because if you remember, or I don't know if you know, they hold 60% of their weight up front. And so having to go downstairs is just a lot tougher if there is pain in that front end. A lot of owners may indicate that, you know, they're starting to see stiffness. And again, they'll associate it as they're getting older. Lagging behind in walks, you know, if the animal is one that when they were younger, they just loved to walk, and then now they're just kind of sniffing more or not, their owners are having to pull them. And then even that nighttime restlessness. Okay. So, and keep in mind, when it comes to pain, what's really tough is it can create a really vicious cycle. Because especially in our older animals, if they're starting to develop some cognitive decline, and then now they're in pain, they can become really anxious, okay, which then can add to some of their cognitive changes. And then we're kind of in this vicious cycle of where does it all begin, you know, or end. And so I think, you know, we need to really try to be on top of, you know, trying to assess whether or not these animals are in pain. A great way to get this information from our owners is this CSAMP assessment. And basically what this is, it's a client-specific outcome measurement questionnaire, and you're just, you know, you can put it together and just ask simple things, you know, for instance, like, are they having problems with stairs? You know, are they having problems getting up and down? Very simple questions, you know, about 4 questions, and it's a easy way for you to, when they come back in, you know, you can present it to them again and say, have you seen any improvement with that? Zoetis has a really great, as you guys all have seen, the canine feline OA pain assessment on their website. So that's really good because they actually have little videos of, you know, these dogs and cats doing little transitions and showing owners, this is what it looks when they're in pain. This is what a healthy, you know, non-painful animal can do. And then there is many other scales. I believe that simplicity is best because owners aren't going to necessarily take the time to read every single question. So as simple as you can make it is going to be better for them. The other thing that we really like is having the client do videos or video at your clinic, because it definitely is a really good tool to have in order to watch their transitions, watch for lameness, because especially if a lameness is really subtle. And then the biggest thing, you know, just is our hands, being able on physical exam, palpate, is there an area that's really warm than others? Is there a trigger point that, you know, you may be palpating along the back and then they really kind of flinch? I think physical exam is a very good tool, and we should really hone in on that. So the approach, like I mentioned before, it's a multimodal pain approach. There's both pharmacological, which is all that medicine, and then non-pharmacological. And I'll be honest, I am a very strong believer. If we can try to manage our seniors as naturally as possible and then use medication to get them out of episodes, I think it's going to be better for them. Mostly because, you know, as they reach their geriatric years, they're a lot more fragile. And, you know, they may get sicker faster or easier. And a lot of times too, you know, their microbiomes in their intestines are changing. So the fact that medication may be a little harder on them. And so it can, and many of them are starting to slowly show changes in kidneys, even though we may not be able to see that on blood work yet. You know, we know with just aging that you know, these organs are slowly aging also. So approaching it with an animal that is in a lot of pain, you know, if they're able to handle NSAIDs, then usually we'll kind of start off with an NSAID to try to help manage the inflammation. You know, knowing that, okay, if they're older, maybe what we need to do is when they start the NSAIDs is maybe also put them on like Pepsid or omeprazole, just to kind of help with any increased acid buildup. And the other thing is, you know, adding amantadine. Amantadine is a very good medication to kind of help prevent that whine pain from getting any worse. And although it's not the, it can help on its own, it works a lot more synergistically when given either with an NSAID as well as gabapentin. Gabapentin's another one, and as you may know, many, you know, there's that fight of, is gabapentin helpful? Is it not helpful? Just like with that tramadol. And, you know, I think there's a place for it. I think just like us, every animal's different on how they respond. I think some animals respond really well to it and some don't. But remembering to let the owner know it does need to be given consistently in order to truly be effective as a pain medication. One thing that I have been using a lot is ketamine. I use it on a sub-Q dose on animals. And there are times where I will actually recommend an actual pain holiday. And what that involves is they stay with us for about 6 hours, and all they are on are IV fluids and a ketamine CRI. And basically it helps to kind of reset that pain receptors, because I think we're with the oral meds, we're here, but the pain is still, and we just haven't gotten to that point. And I think the ketamine helps with that, as well as it can actually help because amantadine and ketamine are in the same family. It kind of helps to get that amantadine at that target level. There are times when I will recommend acetaminophen for an animal that an owner will say that they're really in a lot of pain. It's one that's easy for them to get at home, and most dogs will actually tolerate it well. And then, as you guys all know, there's that new Librela, and for kitties, Silencia. And so that anti-nerve growth factor monoclonal antibody is now out there. For OA, it was made specifically for osteoarthritis pain. I think we're still kind of getting a feel of whether or not It will be effective for other types of pain, but the research was specifically for OA pain. And then the question will be is how is it really helping with inflammation? And again, because nerve growth factors are released during that neuroinflammation, although the research hasn't really focused on the inflammation, the thought is that it is minimizing the inflammation also as you're lowering the level of the nerve growth factor. So that's another thing that we have in our pocket. So for the non-pharmacological ways, again, weight management is so critical to really help manage inflammation as well as pain. Keeping in mind that, when an animal is strong, it just helps them, one, burn calories and use the calories more efficiently, as well as it does help them protect the joints, okay? Adequan. Adequan, if I know an animal has OA, Adequan's usually one of my first things I will recommend. If they are already on Adequan and say they've been on it for like years and they're like at a once a month dosage, I will highly recommend they reload it and then slowly taper it down to the best frequency. When they're tapering it down, I have owners really watch their animals to see, are they seeing, stiffness at that 2-week mark? And if so, that may be the sweet spot for their animal. Joint supplements, omega-3 fatty acids are one of the supplements done a lot of research on that has been shown to really be helpful for keeping inflammation down. So usually my go-to is omega-3 fatty acids and Adequan. I know that Antinol uses the green lipid muscle, again, another great omega-3, and I understand they have now added krill oil to it to kind of help, I think, the transporting of the green lipid. I have down Duralactin. That is more of a natural anti-inflammatory. It is the main ingredient is microlactin. And being that it's all natural, it can take, I believe, like 3 to 4 weeks to really build up into their system. But again, I offer that, or I tell owners about it, because if their dog can't handle the prescriptive NSAIDs, I do feel that Duralactin is very beneficial. And then I do like Flexidin Advanced, mostly because it does work with the immune system, and I do, with the immune system, it uses that undenatured collagen, type 2 collagen. And so the body recognizes it. And when it's released in the joint from the breakdown, the immune system shouldn't react to that. And then ways that we can actually help with the pain is most of us, or a lot of us, are getting lasers or photobiomodulation. That has been really good. PEMF, which is that pulse electromagnetic field. It's funny because owners are like, well, what is that? And I honestly believe that it helps. It helps with a lot of our migraines. And so, we offer the CC loop, as well as we do tell owners about the PEMF beds. And it is a way, it's a nice tool that I think owners are happy to be able to actually actively be able to help their animal. And I think that's a really big key for our senior patients, is if we can really get those owners to be happy that they're making a difference too, they'll be, so appreciative of us. Shockwave therapy. Shockwave is that high-powered sound, ultrasound, where it really does help. They have shown, the research shown, has helped with pain, as well as healing of, tendons. And then acupuncture. Acupuncture, I believe, for our senior animals is so important. What we tend to see with our seniors is their energy starts to slowly diminish. And I think acupuncture really helps to boost that energy, as well as the massage, because with massage, you're actually hitting so many acupuncture points. And massage, I do think massage and heat therapy are so important with our senior animals. Again, with that myofascial pain, I think massage and that heat therapy can be so beneficial. They don't necessarily, they may not be getting up as much as they used to. So, doing that range of motion and helping them, really kind of see how just doing that range of motion and doing getting the muscles warm can really help them be a little stronger. I put down back on track coats because I find that that's really beneficial. Back on Track is a company that started off with equine blankets, and the fabric that they use tends to retain the natural heat of the body. And so what I usually recommend, especially these animals that have a lot of back problems, use it at night, because then in the morning their animals are not as stiff. And a lot of times use it during the cold weather. I have cryotherapy down. That icing can be good. It's usually after an acute incident. So for instance, like if they're walking and then all of a sudden you notice a lameness, ice the area, because it's going to prevent the spread of the inflammation. And then if we're really dealing with, specific joints of arthritis and, this chronic pain can't really be controlled, then many times, we may have to do more of a direct joint intervention, and do joint injections like PRP, stem cells, synovitin, steroids. Usually I steer away from stem cells unless the owner has already done the procedure and they have some saved up. But usually these older animals, I usually kind of veer away from the stem cells because we do need to do a surgery to gather it. And then how can we optimize the quality of life of our animals? I think the biggest thing is we need to keep them comfortable, and we've got to keep them moving. Again, weight management, incorporate some fresh foods, even though they're on kibble, still tell them to incorporate some fresh foods. They don't necessarily have to stop the kibble, but I do think fresh foods has a lot of means to be able to to keep the inflammation down. I mean, if you think about it, if we're trying to eat foods that are non-inflammatory, why aren't we doing the same thing for our animals? Exercises. Walking's good, but exercises really concentrate on muscle groups. Weak and fat, unfortunately, is bad. An animal is gonna have a really hard time because that extra weight on their joints just kind of can collapse that joint. If you have strong and fat, it's not as bad because they do have that muscle strength to help support that joint. Again, manage inflammation, use pre and probiotics. Again, everything leads to the gut. Our older animals, you know, their microbiome changes with age, and for them, you know, they may need more fibers, but versus, and that's where I think probiotics, because again, you have a strong intestinal tract, it strengthens the immune system, and it helps to build muscle. Trying to manage pain. Again, if we can manage inflammation, that will help control pain, and then they'll want to move. Because where there's inflammation, a lot of times there's going to be pain. Making changes to their home environment. You know, they may not be able to jump up at like they used to, so using ramps, elevating the feeding and water bowls, making sure that, you know, if the owner has a lot of slick flooring, that they're using, you know, yoga mats or rugs. They're going to use rugs. The big thing is making sure they have that no slip rubber thing underneath it, because rugs can slip. Making sure that owners that their animals' nails are clipped and the fur is not covering their pads, because they need that for traction. Helping them with orthopedic beds if needed. Like I said, the big thing, we got to keep them moving. So talking to them, you know, short multiple walks don't cause as much inflammation. So, you know, doing more 15-20 minute walks multiple times versus 1 hour walk. And then working on strengthening the muscles of stability. You know, exercises that help them with everyday activities, such as sit to stands, because it's like squats, so it really helps the quads and the hamstring. Getting them to stand for endurance. Okay. The other thing is, you know, if they're standing, doing a little bit of weight shifting. So what you do is you just kind of you know, what would you say, you're pushing one side to the other in gentle motion, and what that's doing is that's helping them with their conscious proprioception. Okay. Even when they're standing, you know, taking their paw and rubbing it on that ground, so that, especially in the hind end, so that they get that feel, and that's great for conscious proprioception. Doing a pause up. Again, this little geriatric canine fitness is what I mentioned in the beginning. It's a little book that we actually created, that we gave out at Old Dog Haven. Talks about arthritis. Talks about what to do for warm up. Has a QR code to show one of our massage videos. It has QR codes for different exercises, really simple exercises that owners can actually do with their animals. So if you're interested in getting this information, again, just send Izzy your guys' email in the chat. And so I really believe that we can make a difference in our seniors. It's a growing field. And let me tell you, when you have an animal that you have extended their life for 6 months, even 2 years, it the owner, to see the joy in the owner's eyes and realize how appreciative they are for what you've taught them, what you've given to them, that's what we need more of, especially in our field, to have owners really, appreciate us. So this is this is one of my patients, Sitka, and she actually came to us in 2019, and she's going to be 10 in February. She came to us with a shoulder tendinopathy, and then she's slowly developed a lot of arthritis in both of her carpi, and in basically all of her digits. But by maintaining her weight, she honestly, the only medication that we actually just gave her the other day was Librela, but she uses carprofen only as needed. She's on Chinese herbs, she's on joint supplements, and she is still doing frisbee play. She does fly ball, and she does dock diving. And mom is just the happiest to see how active she still is. So we can do it. I know we can. And it's a matter of educating ourselves as well as educating our owners. So I borrowed these tips from Dr. Leilani Alvarez, who works at AMC, and her tips for seniors are: 1, keep moving. Okay, we got to keep them moving. Add, whether it be natural or prescriptive, anti-inflammatories. We didn't really talk about a lot of antioxidants, but antioxidants are really good, especially for the cognitive changes that these animals may start to develop. Rehab, and this NPEDS is basically is the non-pharmaceutical anti-inflammatories. And when it comes to rehab, they don't even really need a formal rehab, but adding exercises. If your animal still loves to go into the water, taking advantage of the water. I do usually recommend, if they're going to actually swim, to use a life jacket. 1, because it floats them and it encourages them to use all 4 legs. And it's usually the hind end that tends to go out the fastest. And then really environmental modification. It's basically the acronyms for care. So and so that's it. Let me look at some of the questions that we have. So a question was, another CE had mentioned that GABA really needs to be every 8 and at higher doses to see a difference. So I agree. I believe the half-life is really 8 hours or 4 hours, and to be truly effective is 8 hours. But I personally feel that when an animal is on like an NSAID and a amantadine, that you can stretch out that GABA a little bit longer. And it's hard with some, I do think it's hard for some owners to actually give every 8 hours. But I think 8 hours is the highly recommended frequency. Pregabalin, it varies. I tend to use more pregabalin for the animals that may not get that, tend to get a little bit more sleepier or on the gabapentin. But I'll be honest, I tend to go more NSAID and amantadine. And I've now kind of made it where gabapentin is kind of my last one that I use. Another question is, the Back on Track coats are available for dogs, cats. Yes. So if you go to their website, you just type in Back on Track, they have for dogs. I think you could use it for cats, use the small dogs. I don't think they specifically have it for cats, but you could use the small size for cats. And it's really good. They have it for people too. And I actually have a neck brace in, let me tell you, it really does work. I have a lot of owners asking about chiropractic, and I just feel there's so many levels. Okay. So my opinion on chiropractic, I do think there is a place for it. But my feeling too is you really got to work on the myofascial and the muscles, because we can adjust a vertebrae. But that being said, if the muscle is tight, it's just going to go back into place to where it was. So I do think you really got to work on the muscles. And that's where I think massage, and maybe even helping with the stretching and the trigger points, may be more beneficial. That's just my feel. What fresh foods do I recommend? So I like Just Foods for Dogs. I've tried Farmer's Dog, and I've also tried Num Num. I think they're all fairly good. My approach, I'll be honest, my approach to food is a lot more that food therapy through the Chinese medicine approach. But I do tell, and I understand it can be very expensive. My dogs eat better than I do sometimes. But what I do tell owners is that even if they can't do all fresh food, minimize the kibble and add fresh food into their diet. I do also recommend that if they can't afford, that fresh food, give them some of the food that you're cooking. Just don't season it the way that you would normally season it for yourself and stuff like that. I talk about giving, I don't know if you guys have heard of green juju. That's a really good fresh frozen greens soaked in bison bone broth. But even just starting with something like that can be really beneficial. Yes, I have used Myos, and I do usually recommend Myos Canine Muscle Formula. I do feel as though it has helped to slow down muscle loss, specifically more due to disuse atrophy. But I do feel it also helps with slow that muscle loss due to aging. And many of my owners that have had their animals on it, they feel that it has given the dog a lot more energy. And I do think that's because it's supposed to also enhance the health of the muscle. So I do recommend that for my older animals. Let's see, what else? Did you move it? Oh, okay. What do I think about the Librela and Silencia? Silencia I love because we don't really have anything else for kitties. And Librela, I'm still getting used to it. On it, I usually will first see what the animal is on before I recommend it. I do also like to confirm that they actually have OA. I'm not one that will just, put them on it. And as well as I definitely make sure that they do not have any neurological disease. Mostly because what I get worried about is these animals that we have put on Librela, they are feeling good, which is wonderful. But if they're an animal that has not really been really active, the concern is that they get to the point where they're, woo, we're feeling really good, and then the owner just lets them go off and do whatever they want to do, and then they put themselves in a situation where they have hurt themselves. And that's a big thing that I worry about with back problems. So if an animal does have an underlying back problem, the question would be is, I really stress to the owner, you cannot let this dog go, haywire once they're feeling good. But yes, I do. We have used Librela here, and a lot of our animals that we have it on have multiple joint OA. Thoughts on Cosequin and Dosquin? Ooh, that's a hard one. After going to a conference, knowing that there is not really a lot of research that it is effective, I have actually pulled away from offering Cosequin or recommending Cosequin and Dosquin. So I do omega-3s and Adequan. Let's see. What dose of ketamine do I use subcutaneously? I do a 0.5 mg per kg sub-Q dose. Are there specific antioxidants? I have actually recommended for some of these animals that have cognitive changes. I usually tend to recommend Senalife. I'm sure a lot of you have heard of it. It does, it's a mixture of multiple antioxidants that have helped, natural antioxidants. I do recommend MCT oil for cognitive changes. And there is another brand called CogniCaps that we've recommended. Let's see, what about prescription joint diets? I do think there's a place for it. And again, I am big on, yes, use them, but I do also recommend, mixing it with some fresh food, because there's a lot of fresh foods that basically have very high anti-inflammatory effects. Probiotics, again, what it does is it kind of helps to strengthen that immune, that colon, and keep those the microbiome in that colon nice and healthy. Again, just like us, everything leads to the gut. And if you're going to have a dog or a cat that is always having diarrhea or soft stool, they're not able to absorb the nutrients that they need to keep them strong. And so keeping that healthy gut is so critical in our older animals. How long does the ketamine last? It really varies on every animal. I've had animals where we've given a sub-Q ketamine injection and it's lasted a whole month. I feel that when an animal has had a pain holiday, and then we do a sub-Q like 2 to 3 weeks later. They do well. I think the length of time is really dependent on how painful that animal is. So if that animal is really painful, then it may be weekly for, you know, a month, just to kind of get all that pain under control, and then being able to see if you can extend that out. And again, this is trying to help you get the pain under control, so then what you can do is actually include all other means to try to help manage that pain. Do you have a good reference for PRP treatment in dogs? I don't know. I will check into it and send it. We have a lot of papers and I'll have to really look through them. So any other ones? So thank you again. If you guys have any other questions, please feel free to email me, or email the clinic and they will send it to me, because I am always happy to answer any questions. Again, it's a great field. I think senior medicine is where it is at, and I think we really need to be on top of it to really help our animals as well as our owners, help their animals have a great quality of life and great age gracefully. Thanks a lot.